Cool. So, yeah, this presentation does not encourage or condone any illegal activities, including but not limited to the use of illegal substances. This is not a substitute for mental health or medical services. This is not a substitute for medical, psychological, psychiatric diagnoses, treatment, or advice. So there is a lot coming out about psilocybin used as a therapeutic medicine in conjunction with therapy. Uh, the first thing I like to just tell people is use your discernment, go slow, and be safe. So what you will learn today. What is psilocybin? I'll give a brief background on psilocybin. Safety, contraindications, risks. What is depression? Modalities for alleviating depression, working with psilocybin for depression, and integration. And if you are able, if it's safe for you, if you're not driving, if you have a writing utensil and paper available, we'll be doing an exercise during this talk as well. So a little about me, right? Like, who is this guy talking about psilocybin? So my name is Josh or Joshua Jupiter. I'm the founder of Brooklyn Balance LLC. I am a full-time psychedelic integration coach and facilitator. I have various certifications and professional trainings, including but not limited to TAM integration, MAPS, psychedelic support, and more. Also, fun fact is I'm a native New Yorker. So a little background on me. So I had my first life-changing psychedelic experience in 2003. Later on in 2008, I began to have really debilitating panic attacks. I couldn't leave my bed. I could barely go outside. I was just very trapped in my apartment. And so I went on SSRIs. I was prescribed citalopram. And I was on that for about 8 or 9 years. And in 2016, I weaned myself off of SSRIs and I began to explore more with psychedelics with my therapists and my community members. In 2020, my background is film production. I got burnt out. I was working 80 hours a week and I pushed pause and pursued a new path. In 2022, I founded Brooklyn Balance LLC. And this past year, I did the MAPS training. I graduated from TAM Integration's 12-month certification program. And now I am here in New York City working full-time as a psychedelic integration coach and trip sitter. So some of these photos I just like to share. This is up on the upper right. It's me at the MAPS conference in Denver back in June. This is my cohort from TAM Integration. And if you're familiar with MAPS, this is Rick Doblin and I. So real people, real results. So these are two things that people have said about this work and working with me. I came to Brooklyn Balance due to suffering from continuous treatment-resistant depression. I've suffered with depression for most of my adult life. I'm 60. I've been on most of the well-known antidepressants as well as some not well-known. I've continued to notice a substantial reduction in depressive symptoms. This is quite remarkable since I've been on medication most of my adult life. Other than an emergency appendectomy in 1995, I don't think I've had anything impact my well-being so much. So yeah, it's a little background on me, and we'll do a Q&A at the end as well, if anyone has any questions about more of like my experience and my background. But moving into some background on psilocybin. So I always like to begin my talks with this quote from Chris Bosch, which is from the book LSD and the Mind of the Universe. From ancient times, men and women have gathered under the night sky and taken substances that help them commune with their inner being and with the life that turns through all things. They have sat in prayer and silence, seeking healing and guidance so they could return to their lives better people and more aligned with the deeper currents of life. Because these substances opened them to the spiritual dimension of existence, they were called sacred. Because they healed the wound of forgetting who and what we truly are, they were called medicine. From before written history began, the sacred medicine path has been one of the most spiritual paths human beings have taken to find themselves, each other, and the divine. So, what are psilocybin mushrooms? So, I imagine a number of you here already know a bunch about it, but just a little more background on it. And for those that who don't know, they're commonly known as magic mushrooms. And some people call them shrooms. I actually really don't like that word, uh, but just to bring awareness to it. They're a fungi. They grow naturally all over the world, and they've been used for thousands of years by humans. They're a classic tryptamine psychedelic whose mind-altering effects can last 2 to 8 hours. They are a Schedule 1 substance, and they grow naturally all around the world. It would be incredibly difficult to overdose on psilocybin mushrooms. For that to be considered, over 2.6 pounds of dried mushroom would have to be eaten, which is almost 2,000, which is almost 2,000 times a typical therapeutic dose of 3 grams. Psilocybin itself is biologically inactive, but it quickly gets converted to psilocin, which creates mind-altering effects which bear similarities to other substances such as mescaline, DMT, and LSD. So a bit of a timeline on psilocybin, right? So back in like 5000 BC, there are ancient paintings of mushroom-head humanoids, and they're in caves on the Tbilisi Plateau of northern Algeria. And then like 1000 BC, there's evidence of Central American cultures building temples to mushroom gods, and they carve these mushroom stones here, the little image on the right. In 1914, the first experience documented in a scientific science publication of intentional psilocybin mushroom ingestion occurred. And it details descriptions of visual effects, hallucinations, uncontrollable laughter, and joking. More so in 1953, mycologist R. Gordon Wasson visited Oaxaca, Mexico to witness a mushroom velada, a ceremony. And he returned again in 1955 to photograph and participate with Maria Sabina. Maria Sabina is a well-known mushroom facilitator, and she educated him a lot, and a lot of that knowledge therefore got passed along to North America here. In 1958, Albert Hofmann isolates psilocybin and publishes the synthesis of psilocybin at Sandoz Pharmaceutical. A couple of years later, Sandoz created 2 milligrams psilocybin pills, which you could get a prescription for. So 8 years later, the Staggerds-Dodd bill passed, making possession of psilocybin and psilocin illegal, followed by the Comprehensive Drug Abuse Prevention and Control Act in 1971, which made it a Schedule I substance. So Schedule I basically means that it serves no medical use and that there's high potential for abuse. So today, many years later, there's a lot of new stuff coming out about psychedelics. There's a lot of new stuff coming out about mushrooms. This is just some of the headlines that I'll put together here for it. And we're seeing the positive effects of psilocybin. And more studies and research are coming out every day. So this image here on the bottom left is one of my favorite images when talking about psilocybin. So in a study, one person was given a placebo and one person was given psilocybin, and they were both given an fMRI. And so you can see here, this is like the neurons and activity in the brain with the placebo. And with the psilocybin, there's just a lot of neuroenergy being generated and neuroplasticity. So the neurons are firing off like exponentially here. And we'll talk more about that later. So through the research done and with the things that have been coming out, we're seeing positive effects of psilocybin in conjunction with proper guidance. So some of the things that we're seeing that there's alleviation from cluster headaches, alleviation from depression, anxiety, increasing mindfulness and feeling of interconnectedness. It may increase your relationship with nature, spirituality, the universe. It may increase creativity, cognitive flexibility. It promotes neuroplasticity, neurogenesis. Neurogenesis was the word I was trying to remember in the previous slide. And it may be helpful with substance abuse and addiction, including tobacco and alcohol, as well as PTSD. So this is one of my favorite studies also. So this was a study about harm caused by substances by neuropsychopharmacologist David Nutt in 2010. And its focus is really on how these substances not just affect people's health, but affect culture and society. And so we see here that mushrooms had the least harm with all of those substances that were studied. So moving into like risks of psilocybin, right? We're going to talk about the benefits and how they may help people, but it's not for everyone. Psychedelics are not for everyone. They're not a silver bullet, and there's a lot of things to consider before taking. So this is a short list that speaks to some of that. Behavioral risk. How will they affect your behavior? There is a risk of HPPD, and that's where you remain seeing hallucinations even after the medicine has left your system. And for some people, that can persist for months or even a lifetime. Some people may experience what we call a challenging experience, formerly known as a bad trip. If someone has borderline personality disorder, schizophrenic tendencies, it's advised to not to work with psilocybin. It can be very risky. If someone is on a pharmaceutical medication such as warfarin, digoxin, lithium, there can be a risk. Lithium particularly causes seizures. SSRIs and SNRIs, there can be a risk of serotonin syndrome as well as blunting. Serotonergic migraine medications, antipsychotics, and contamination. So if you're considering working with psychedelics or psilocybin and you're not sure if it's safe for you, I put the information here for Dr. Ben Malcolm. He's also known as the Spirit Pharmacist. His website is spiritpharmacist.com, and he's a really great resource for advising on that. So there are potential side effects as well. Disorientation, lethargy, giddiness, euphoria, joy, visual hallucinations, synesthesia, perceptual distortions, mystical experiences, pupil dilation, decreased heart rate, decreased blood pressure, body temperature fluctuations, and nausea. So yeah, like there's definitely pros and there's definitely cons. Suitability for use. What are the variables? What is your state of mind? Do you have expectations? Are you willing to engage in therapy or be guided by someone, be coached by someone, listen to someone with experience? What resources and support are available for you in case you need them or if something goes wrong? Is there a cultural understanding, particularly between you and your facilitator? And then understanding uncertainty. I always say something may happen, nothing may happen. And also having a tolerance for destabilization. What do you do when you're feeling dysregulated? And what is your tolerance for that? So moving more into what is depression and the correlation between psilocybin and depression. So if someone's experiencing depression, it's generally defined as a mood disorder that causes persistent feelings of sadness. You might have a loss of interest and typically like hopelessness. So there's other names for depression and things can get very clinical with it. Me personally, I don't really like to pathologize too much. But what I do understand from it is that there are a lot of emotional and physical problems that derive from depression. And it can really lead to having trouble in your normal day-to-day activities. And one of the most difficult things that we might hear is like suicidal thoughts that life is not worth living. Some of the symptoms include sadness, irritability, apathy, being tired, disrupted sleep, lack of motivation, difficulty concentrating, negative thoughts, feelings of hopelessness, suicidal thoughts, that being withdrawn, not engaged in activities, getting teary-eyed, a lot of tearfulness, just a lot of heavy sadness, emptiness, hopelessness. There's various causes for depression. And, like I personally like to say it's important to get it's nice and it's important to get to the root of things, but sometimes it's okay to just allow things to happen and to be in the mystery of things. But some general causes of depression: biology, genetics, health conditions, diabetes, heart disease, thyroid disorders, hormonal changes, brain chemistry changes, stressful and traumatic life events, limited access to resources. So if someone's feeling a lot of scarcity, I don't have enough food, I'm worried about where I'm going to live, I'm worried about this hospital bill I have to pay, or I can't go to the hospital because it's expensive. And then a lack of social support as well. Negative thoughts, problematic coping behaviors. So like drinking alcohol to avoid, like, hey, I had a really tough day, I don't want to think about it, I'm just going to get drunk. Or substance abuse, other substances. So if you battle depression, you may have already been informed of or trying to improve your sleep, exercising, addressing your health issues, taking antidepressants or anti-anxiety medication, going to therapy, and cognitive behavioral therapy. So, and then there's different types of depression: major depressive disorder, persistent depressive disorder, also known as dysmorphia, postpartum depression, bipolar depression, seasonal affective disorder, and psychotic depression. So, also just to like, while speaking about these different types of depression, it's not always safe to take a psychedelic if you're in a very deep depression, or if you if you have a diagnosis of bipolar disorder, because it can be more damaging, or it can even be very risky to do so. So when we start to get like anxious or depressed, it starts to affect our mind, and it really can also affect the body too. So when the body gets stressed, it might experience aches, pain, joint pain, limb pain, back pain, upset stomach. And if anyone here can relate to this, like put a one in the chat. I'm just curious, like, how do y'all relate to this? Does any of this resonate with you? Have you had any experiences like this? Have you had insomnia, difficulty sleeping at any points in your life, tiredness, appetite changes, headaches, psychomotor activity changes? And in general, too, like when we're feeling physical pain, like the more severe the depression can be as well. Yeah, thanks for sharing, Dan. So so what's the connection between psilocybin and depression? So first, I'm going to introduce some recent studies that came out where research was done. And so this first one, there were 30 cancer patients, and they were from a single oncology community practice, and they had been struggling with major depressive disorder. They were administered in small groups. So 3 or 4 of them at a time were given 25 milligram doses of psilocybin. And if you're more like me, a dried mushroom type of person, that's if you're working with a strain like Golden Teacher, that might be like 2.5 grams. But if you're working with something more potent, like penis MB, the strain of mushroom, that might be like 1.25 grams, because different dried mushrooms have different potencies. Yeah, Philip says, I treat my body as a consciousness vessel. Hence, I listen to what it says, and I treat it well and maintain it in great shape. We only have one body. If we do not take care of it, it won't be able to take care of us. I 100% agree with that, Philip. Thank you so much for sharing that. So in this study, the results were very encouraging. They showed a robust reduction in depression in regard to the severity scores coming down by more than 19 points, and sustaining for 8 weeks. 80% of the participants demonstrated a sustained response to psilocybin treatment, while half of them showed full remission of depressive symptoms as soon as the first week, and it persisted for 2 months. And so I always like to add on, because it's like they studied these people for 2 months. It's very likely like symptoms came back later, maybe not. But again, like echoing that none of these medicines are a silver bullet. So in this study done at NYU Langone, I learned about this at the MAPS conference back in June in Denver. So they had 80 participants who had cancer, and half were given psilocybin in conjunction with therapy over 6 months. They saw that the psilocybin assisted therapy significantly improved not just depression, but anxiety, interpersonal sensitivity, hostility, OCD, and somatization. And so I do send out these slides. But you're also welcome to take a screenshot. But if you look here at the graphs, you can witness the reduction in depression that they were experiencing right here in the middle. And then the other ones featured the other experiences that they had reduced. In a John Hopkins study, another one with people with life-threatening cancer, research conducted with 51 patients showed people suffering cancer-related depression and anxiety found considerable relief for up to 6 months from a single large dose of psilocybin. 6 months after, about 80% of the participants continued to show clinically significant decreases in depressed mood and anxiety, with about 60% showing symptom remission into the normal range. 83% reported increases in well-being or life satisfaction. And they were given 1 high dose and 1 low dose. So a high dose might be like 25 milligrams, which can be like 1.25 to 2.5 grams of dried mushroom. And a high dose would be like 2 to like 3.5, maybe 4, but 4 would be like a lot of dried mushroom. That could be like, yeah, 25 milligrams and up. It's considered like medium to large dose. So modalities for therapeutic process, right? So it's like, all right, we have more knowledge of psilocybin, and we know that in conjunction with like therapy, facilitation, coaching, mindfulness, that there can be benefits between using the two. So one of the tools that I like to encourage is Hakomi. Hakomi method is an experiential therapy, experimental therapy. So it means that changes are brought about by the experience that you have in the present moment. The experiences of the body are the key focus. The body is thought to be a resource that holds information like memories and beliefs. So Hakomi involves mindfulness, nonviolence, unity, organicity, and mind-body wholeness. Interfamily systems is like also a modality that I feel is similar to this. What we start to talk about somatics, holding attention in our body, locating it in our body, and just being present to it and noticing it and giving it what it needs, talking to it, rubbing it, releasing it, calling in energy for it, all sorts of things. So I find Hexaflex and ACT very interesting. Hexaflex is a model that is currently being used to better understand the psychological mechanisms involved in psychedelic experiences. So ACT stands for Acceptance and Commitment Therapy. And it's a way to go deeper. And it's a way to just bring in more flexibility. And so it's like, if I'm here and I want to go there, but I can't go there, I can go over here. And now I'm here, but I don't like being over here, I can go over there. And it's really an interesting modality to be present, to drop into what our values are, and just accepting, like, hey, this is where I am right now. And a quote down here I say about that Joshua Schultz Side says about ACT is that it helps clients embrace their demons and follow their hearts. The inner directed approach. So, I mentioned like the word somatics before, and somatics to me is kind of like a fancy word for like body, but like working with the body and being attuned to the body. And so allowing things to arise naturally, we'll see like experiential emotional engagement, encouraging imagination, restructuring cognition, and then transference too. So if you're working with mushrooms with a facilitator, being aware of how the facilitator's energy might influence you and how you might influence the facilitator's energy. Subconscious tendencies, compassion for self and others, transpersonal, spiritual, and imaginal exposure, right? So these are just like couple of modalities, these few slides when it comes to like bringing in to doing the work. So moving into like bringing in changes into your life. So if someone is feeling depressed, it's looking into like, hey, well, what might be causing this depression? And so, as humans, it's very natural for us to just be like, I'm having pain, I'm having suffering right now. I want this suffering and this pain to just go away right now. And like, that's being in the moment. And it's, yeah, like our nervous system's going up and like, we're just thinking about that. But it's like, well, why does this pain, why does this suffering keep coming up for me? What do I need to consider about the long term and making changes and maintaining them daily, weekly, or monthly, yearly, so that they'll stick and that there's less pain and less suffering in life. So I'm going to invite us to do a exercise, which is why I said if you're able to have a pen and paper nearby. So if it's safe for you, and if you're able, if you're in a quiet space, I'm going to invite you to do a meditation. And we're just going to be brief here. It's not going to be long. So if you're unable to do so, we're just going to be a few minutes. But we're all participating in this regardless because we're all here. And I like to always say that, like, even as an observer is participating. An observer is not an outside, and an observer is included. So yeah, if it feels good to you, I just invite you to sit with your back straight, spine tall. Invitation to close your eyes or soft gaze to the floor and just start taking some deep belly breaths in through your nose and out your mouth. Feel your belly rise and feel it fall as you exhale. And just take a few deep breaths. Just begin to notice how you feel in this moment. And I invite you to imagine what a perfect day would look like for you. What does it look like? What does it feel like? What does it sound like? Is there a smell? Are you with people? Are you alone? Noticing what that day brings up for you and what's happening in it. How things might be able to be fun, exciting, tranquil, relaxed. Notice what's happening in this moment for you. Look around. Where are you? What are you doing? Who are you with? Maybe take notice that all of this that you're thinking, that you're imagining, envisioning, is just coming from you. It's not coming from anywhere else outside. You're choosing this. You're choosing your perfect day. Keeping your eyes closed or soft gaze to the floor, shifting into intention. What are some goals that can move you in the direction of creating this perfect day, to step into this vision? Think about some specific things, little steps. Is there anything confusing? Is there anything that's challenging, that feels unsure to get to that perfect day? What do you need to get clearer on for that, to get better clarity? What do you notice emotionally with that? Take a few final breaths. Take a moment to recognize that the work never ends. That all this work, all this progress is continuous. And each day is a new day for doing so. Still breathing. Slowly come back to the room. Notice where you are. Notice how you feel. Do what you need to do to be present. And yeah, moving into reflecting and integrating the past few minutes. If you have your pen and paper, writing down what resonated with you, what felt good, what do you have the most resistance with? Whatever you have the most resistance to, that's probably what you need to do first. And I invite you also, if you're comfortable, share in chat. What are some things that are present for you that you can take action with? I know that for me, I noticed I wanted to, earlier this week, last week, improve my environment, improve my apartment. So I made a little list and I said, I want to buy an alarm clock so I'm not on my phone first thing in the morning to turn off my alarm. I want to buy a new altar. I want to buy a new desk. And I ordered one very promptly. And I started to put little notes as to all right, well, where do I want to buy that? What kind do I want to buy that? And researching. So yeah. This is like a little exercise meditation. A few more questions here. That would just be repeating myself as to how to take notice of what we want in our lives. And it's like, yeah, it's easy to think about it. It's easy for me to say like, hey, yeah, I want a new couch, but I have to like make time and space to buy a new couch. I have to research it. Can I like, how much do I want to spend on a couch? What's it going to cost to be delivering? It takes up time and energy and it could be exhausting. And so it's just like, but putting things in motion, and when we see it, we can make it happen. So yeah, moving more into like thoughts. So someone I study with by the name of Dr. Stacey Ellis, she likes to say thoughts are not real. They're just ideas presented to you. So like when we relate to our ideas, ourself and others, thoughts may be correct, thoughts may be incorrect. They might be clear, they might be distorted, they might be confusing or focused. So we're going to touch upon like CBD and CBT and our thoughts. So if we're battling depression, some thoughts might sound like, I'm a failure, I'm at fault, nothing good happens to me, I'm not worthy, there's nothing good, I can't change, it's hopeless, they're better off without me, right? Like beating ourselves up. Like if you can relate to that, put a one in the chat. Like big one over here, like more so in the past. Um, so, so where do these thoughts come from? So a lot of these thoughts come from our early experiences. So like, were we criticized a lot as an adolescent, bullied, abused? What events might have been triggering for those programming is a word I like to say, uh, put into our mind, into our subconscious to create our core beliefs, right? So our core beliefs of judgment, worthiness, and then like creating limiting beliefs, getting us to start to assume things that are not true. So like we start to think like, I got to please other people before I please myself. If you can relate to being a people pleaser, put a one in the chat. Like, I know I can. Less so these days, or pretty much not much these days. Uh, you know, critical incidents that can happen when you're older too. So like someone in your family getting sick, did you get laid off or fired, career transition, in some countries like a terrorist attack, uh, or a medical diagnosis. And we might go into like automatic negative thoughts. I never get it right. And this can really like perpetuate symptoms of depression. Yeah, Philip says, indeed, feelings and thoughts are not real. They just bubble up and we can spiral into them or we can dismiss them. Our choice. Absolutely. Yeah, I really appreciate you sharing that. And yeah, Steve, yeah, thanks for putting a one in the chat. Yeah, thanks for sharing. So something I like to say is like my vibe attracts my tribe. And it's like, have you ever noticed in your life that you keep attracting the same kind of person? Uh, like maybe, for example, you're the kind of person where people keep coming to you for help. Or like people keep coming to you and asking you for money, or can you lend them this, or can you help them with that? And it's like, you stop it when you wonder, it's like, why do these types of people keep coming to me? So it's like, we might be thinking a certain way, and because we're thinking a certain way, and because we do things that let out an energy, that let out a vibration, it attracts that energy. So it's like, if that is not serving us, what are some things we can do to change that? So getting a little more into CBT, right? So like if I think, for example, I don't have many friends, like we might feel people must not like me, so I feel sad. But if you reframe your thoughts, if you look at things like from another perspective, it's like, this is what's in the front, but let's go in the back. We go in the back and it's like, no, like, let's look at this differently. I have a couple of friends, but the group of friends I have is a small group of friends, and they're really special to me. And if I put things in motion, I can make more in due time. Right. And so, right, this is talk about psilocybin and depression. So, mushrooms have a way of opening the subconscious and the mind, and they allow for the ability to shift the way we look at things. And by combining like different tools and modalities as the ones that I'm talking about, we can utilize that to our advantage for changing the way we think, looking at ourselves and others. Right. And so, just to speak a little bit more about mushrooms, it's, like I said earlier, they generate more neuroplasticity. And they'll also like they may have a way for some people to open us and to expand us. And then we'll experience neuroplasticity after or not. And it's during that time where it's like, oh, when I was in my journey, I just saw things a bit differently. And so it's like we had that there, but then therapeutically, how do we start to like notice what are our thoughts and shifting our thoughts through integration and therapy, right? So it's like imagine your life is like a movie and you're the screenwriter. Can you flip the script? So like if you might say to yourself, man, I'm a mess. It's like, how can we be a little more compassionate and softer on ourselves and just be like, I'm human. Like things get messy sometimes. I can't do this. I can do things. I can do hard things, or I can put effort into doing this. Why is this happening to me? What is this teaching me? Something bad happens, an event happens. How can we learn from it? Some more examples. My friends are probably angry or unhappy that I'm not going to see them tonight. Maybe try, my friends are happy that I'm taking care of myself tonight. I'm neurotic. I am particular and attuned to my needs, and I can take care of myself. I am too rigid. I am working on being more flexible. Yeah, Philip shares psychedelics permit us to observe ourselves from a neutral perspective, allowing to see habits we do not resonate with, hence giving us the choice to change. I agree with this. I agree with this for myself. And I always say, like, when it comes to like words like us or you, it's like what might happen for me might not happen for everybody. So I just like to like always remind people, especially people that are new and exploring this, about that. Right? It's like I'm bad at yoga. Well, if a yoga teacher ever said that to you, like in yoga, there is no good and there is no bad. Like I try my best at yoga. I'm not good at playing the piano. I recently started putting effort into playing the piano and intend on practicing daily to improve. So, right, when we start to like notice more about our thoughts and noticing like how our thoughts are impacting us, something that can really benefit if we're trying to make changes and improve ourselves with things such as depression and other things as well, maybe anxiety, is tracking it. So, in this example, it's I made this up, but it's like, how do I feel on Monday? Oh, I'm having like 40% depression. How do I feel on Tuesday? I had breakfast alone that morning. I felt really depressed more than Monday at 70%. But the next day, I just took a walk and my depression was less. Thursday, less, had a phone call with a friend. And then Friday, breakfast alone, a bit more depression. So, what do I learn from this? And what do I need to do and change for myself to mitigate and put preventative measures for the depression, as well as like calling in things for improving life? Yeah. And tracking our activities, it helps provide a structure. We'll learn about what's priority, what's not a priority. Well, I got really upset when I was talking to my friend on Tuesday. Maybe I need to talk to this friend less or at another time. It helps prevent ruminating, uh, just like fixating on thoughts and going like, well, why was I thinking that? And spending a lot of time just thinking about one thing, looking at like the larger picture and learning from it so we can realize for the future and therefore have less rumination. Tracking what gives you pleasure, changing perception from chaos to manageable tasks, increasing the chances that activities will be carried out, and enhancing our sense of control. Yeah, some other tips I can suggest for alleviating depression when working with psilocybin, which are equally as important during preparation and integration. Continuing to do deep breathing, journaling, CBT, exercising, socializing, limiting caffeine, meditation. Yeah, thank you. Getting good sleep, resting, avoiding alcohol, stimulants, narcotics, and for some people, cannabis. Cannabis can be good for some people, and it might not be good for some people. It's a very interesting medicine of its own. Establishing boundaries and getting firm with your boundaries, getting more attuned to like what am I a yes to, what am I a no to, in mindfulness meditations. Yeah, learning about what triggers you. How do you respond to your triggers? Are you reactive or do you pause? Do you go into fight or flight? Reparenting as a tool, asking yourself, what do I need? I'm a big fan of internal family systems. And yeah, better understanding consent and sovereignty, right? Knowing that like we are sovereign. We make our own choices and we decide our own path. For me, it's like if someone asks me to do something or requests for me to do something, I'll like pause, think about it, and like really drop into if I'm a yes or no to it. And that will like really like it's really impacted me with doing so and pausing that. Yeah. Inner team dialogue too. Yeah, thanks for sharing, Philip. Appreciate that. As we mentioned, tracking patterns, recognizing where's the chaos, when are you suffering? And when it comes to chaos and suffering, we like growing up in that kind of environment, we get very used to it. And it might create feelings of like I can't trust, or it's harder to love. And like the psyche gets really filled up with fear. And so it's like, how do we work with that? Recognizing that like we do have agency and that like we can open our hearts, our minds, and our souls to love. What was normal in your development? And how are you reproducing that pattern? Right. And so like that's more about like touching upon like what are what are the good parts and what are the bad parts? No, like not bad. There are no bad parts, but what are the parts in us that might just need more love and attention that we may have inherited from our family members? And so what we change in the body, we change in our mind. And so it's like, what's something we always worry about? Money, health. Worry gives us a sense of traction, as does suffering. It gives us a familiarity. So if we're feeling depressed, it's like we're just so familiar with this feeling that it can be scary to think about what it's like to not experience that feeling. And it's like, yeah, embracing the younger version of self, like talking to the parts and talking to ourselves when we were younger. Like, what happened before like certain events happen to us, and what do we need to give that earlier version of ourselves? And so it's like when we're a child, like we're very present, we're very like in the world, and we're feeling very connected, and like we're very in the moment. And psychedelics can really help bring us to and like relate us to that state of mind. So this is probably one of my favorite things about talking about how psilocybin is a beneficial tool in regard to working with as a medicine. Like our minds can get knotted up, be like a ball of yarn. It's all tangled, and psilocybin can, for some people, help it to just relax and help create more space, lightness, clarity. It can help us get more data about ourselves, and so that we can like straighten out that yarn and relay it, put it into a new ball the way that we want it to be. It can help us to be more vulnerable, and it can help us like see how we're behaving in the world. Many people function as if what they're experiencing is real, right? And so if like our thoughts are not real, they're just ideas that are presented to ourselves. How do we present our thoughts to ourselves in a different way? And like putting new programming in the subconscious so that it becomes conscious. So yeah, there's certain things that may not be there, and we can like help get like a grasp on like how to like reformat that. Right. I just spoke to this. Yeah. And like establishing trust. If you don't trust anybody, it's unlikely that you're going to have healthy relationships. You know, if you're working and you're a manager and you don't trust your team, you're going to be micromanaging. You're going to be like putting all this energy out there of like, you need to do this and you need to do that. Did you do this? And I don't believe you that. And it's going to make your like relationships very challenging. So looking into like who can be trusted and how will trust lead into feeling the pain. And yeah, Bill, exactly right. Like if you don't trust other people, you don't trust yourself. Yeah, really appreciate you saying that. So if you're considering working with a facilitator with psilocybin, it's vitally important to consider what is that facilitator's state of mind. A facilitator's state of mind creates the aura, it creates the energy that will affect you, that it will affect the client or the friend that you're saying, like, hey, you need to go and like do mushrooms. So it's important to really get clear on yourself, but also have a clear understanding as to what is the energy, what is the partnership like between you and the facilitator, and being with your own energy and maintaining it for your own attention to be present for what's true to you. A facilitator's energy should not interfere with your experience. I'm not I'm not going to touch upon this too much. I'll send out the slides, and you're welcome to look at this a bit more in depthly, but I like to talk about balance. And in short, there are different polarities that we have, and there's different ways that we act. And we navigate all of these different polarities. So there's the unaware, wounded feminine up on the upper left. And that's just like, it's not literally like in regard to the female body, like a woman. It's just about the energy in general. Like a man also has and or can have unaware wounded feminine energy. And same thing in regard to like masculine, right? And so it's like, is there a lot of attachment? Is like there a lot of sadness and grief, a lot of drama, like reacting impulsively, like not pausing and just like taking a minute to like drop into things and creating chaos or being like the victim, being needy, self-sacrificing. The unaware or the wounded masculine, aversion, fear, anger, rage, right? Provoking, like I'm going to start a fight, contracting mentally, reacting physically, like I'm just going to punch this guy, controlling, bullying, narcissistic. Yeah, I'm wondering, like, put a one in the chat if anyone can relate to any of these things, right? Like, no one's perfect. But like, I imagine at one point or another we've been there. I can. I'll put a one in the chat. And then there's the aware, feminine, the empowered feminine, love, groundedness, healthy boundaries, being compassionate, abundance and flow and radiance, wisdom, and birth and new beginnings. The aware and embodied masculine, freedom, holding space, creating safety, witnessing without judgment, silence, spaciousness, stillness, knowledge, death and endings. Yeah, and so it's like, where is our balance? What might we be experiencing? Like, where is imbalance? Am I like up here with the wounded and need to drop more into my aware? And like, am I out of touch with the feminine? Like, how can I find the center between all four? Yeah, strengthening all of those pillars and diving into the core wounds as to what may have created those wounds. So when we have a profound experience or when we're in a moment, if we're depressed, it's like things might not always be clear. So something I like to say is maybe this is how I'm supposed to be. And just like taking a pause with that and just thinking like, maybe this is where I'm just supposed to be right now. Dropping into accepting. So, and sometimes we can get exhausted and even more overwhelmed from fighting, trying, doing. I will often see people that rush from like psychedelic experience to psychedelic experience to psychedelic experience, trying to like fix or change something, or people that are doing workshop or education after training after one another. It's like allowing space to just be and say like, hey, like maybe I'm not meant to change this right now. Maybe I can like pause with it, go to something else and come back. Maybe I can surrender. So yeah, again, psilocybin or any psychedelic surely is not a silver bullet or a cure-all. Regardless of the substance, if you're considering working with psilocybin, asking yourself, like, why are you choosing to work with psilocybin? What other parts of your life are you looking to focus on and improve to better improve yourself and the people in your life? What are you calling in? What are you releasing? And how are you practicing keeping it sacred? So I'll say a lot, and the community will say a lot, like being intentional. And when we make something have a sacred energy to it, we're making it special, we're making it unique. It's not like, hey, I'm gonna take like mushrooms and just go dancing at the club and hopefully I'll have this like profound experience. It's like, no, like make it a ritual. Like treat yourself, treat your space like it is a sacred ritual in a temple, in a church, something that's very precious. Yes, if you're in your experience with the mushrooms or any psychedelic, stay with the breath and like tracking your nervous system, particularly like if a memory comes up that might be upsetting or overwhelming. That's an indication that the body may be trying to like talk or release something. So I like to encourage like releasing in a safe, consensual, non-violent, non-sexual way. And staying with the breath and practicing emotional release to allow somatic experiences to occur. So nearing the end, touching upon integration. In Latin, integra, which means I make whole, I renew, I repair, I begin again. Philip says, ask the memory, what are you here? Why are you here? What can you teach me? 100%, absolutely agree with that for sure. Yeah, talking to the memories, talking to the parts. Integration, reprocessing, re-inhabiting, re-embodying, reassociating, restoring, releasing, reclaiming. Right. And so I talked about ceremonial, ritual, getting in touch with like spirituality. When working with psychedelics, it can feel sometimes for some people isolating. It can feel like I just had this big experience and I want to like talk to people about it. But maybe these people can't relate, or maybe these people will judge me. Maybe these people will just not understand and think I'm crazy. So it's beneficial to cultivate community, to go to places to find community that can relate to these experiences. So integration circles are really great for that. Attending an event at your local psychedelic society, and if you don't have one, maybe starting one. Journaling, right? Just letting a stream of the subconscious, being in nature, doing creative arts, singing, writing, creating a plan for the future, and moving into doing new experiences and insights. Yeah, I like to release, like, I like to recommend avoid the news, spend as little screen time as you can as well with integration or in general. Yoga, dancing, hiking, tai chi, qigong, working out, move your body, wellness, spa, sauna, massage, acupuncture. I love acupuncture, chiropractic adjustments, meditation, breath work. And then there's grounding, and then there's also discharging. So sometimes it's like during our experience, we might actually take in energy that isn't ours and might not realize it. We might need to let that go. Uh, I've spoken to a number of people that have had demons come up with them after their psychedelic experiences, and it's like we've had to do like exorcisms is the word I'm going to use to release that demon, that energy that was not theirs, that was disturbing. So eating well and nourishing foods, going to therapy. Oh yeah, and like throw a party, have a potluck, or go dancing. Right. And so like the benefits of integration, taking this time to create space for yourself, to process what happened for you. Upgrade your software, right? You may get increased felt sense, debriefing difficult, challenging experiences, processing emotions, releasing and breathing, translating and applying new insights, embracing and adapting to changes of ego, identity, world, and culture, enhance capacity for self-observing self, increased wisdom, enhanced compassion for self, making sense of potential generational trauma and epigenetics. Yeah, Philip says demons can also be deeply repressed subpersonalities. Totally agree with that. In my context, uh, I I was speaking to just like definitely like outside energy and viewing it as outside, like coming in and getting in there. It can be ours, it might not be ours. So some down the road, and right now there's tons of psychedelic scientific studies happening. And they're focused on creativity, OCD, PTSD, anorexia, alcoholism, depression in Alzheimer's disease, mood post Lyme's disease treatment, microdosing, and opioid use disorder. So nearing the end, I always like to say, like, go slow, less is more. Give yourself time to integrate. The process is likely to continue to unfold for days, weeks, months, years after. I'm still integrating my first psychedelic experience from when I was 16 years old. Transformation is possible with determination and time, with or without substances. And yes, Philip says journal, journal, journal. 100% agree. Trust the medicine, surrender to the process, receive what comes up. Here are some recommended readings that I find beneficial when focusing on depression. The Untethered Soul. I'm doing Depression by Richard O'Connor. It's Not Always Depression, which I have right here. I was reading in preparation for this talk. And Freedom from Your Inner Critic. And again, I'll send out slides. So if you want to come back to this, it'll be in the email later. Having some technical issues. Yeah, and that's it. Like, thank you so much for attending this talk. I do offer free discovery calls. If you're interested in learning more about psychedelic integration, or if you're interested in talking as to how I could be of service to you, let me know. I do post a lot on like Instagram and TikTok too. Brooklyn Balance, Brooklyn Balance Integration. You can follow me there. And if you've registered for this talk, you'll be automatically added to my news blast. Which if you don't want to be on that, you're welcome to unsubscribe, but I'll be adding you. Yeah, thank you, Philip. Appreciate the kind words. So I'm going to stop sharing my screen and I'm going to open it up for any questions. Does anyone have any questions? You're welcome to unmute yourself or type in the chat.
I have a question for you. How do you see microdosing as a really good, as a form of integration? Just say you do a large journey, or some people don't like to do, large. They want to titrate. They want to go small, which is totally great because I find that going small is actually more beneficial or more at the helm. So yeah, I love your thoughts on that.
Yeah, it's a great question. And I was actually thinking about touching upon that, but I was concerned about time. I did do a talk specific to microdosing, and that's I can forward that to you. It's through my website. And microdosing, I think, is amazing. And I think it like it's different strokes for different folks. I know for some people that they may get relief from macrodoses. And I know for some people, they may get relief from microdoses and vice versa. Like macrodoses might totally dysregulate one person. And so like they lean into microdosing and that really works for them. And then there's some people where it's like microdosing does nothing. Like I don't feel anything, I'm not noticing any changes, but macrodoses do. And it can take time to figure that out for the individual. And I fully support microdosing. And I think it's also a really good way to get introduced to the medicine before too. So like I'm a fan of like the Fadiman protocol. And if someone's very new or has never done psilocybin, uh, it can be recommended to microdose before a macrodose so that it's in the system and that there's a familiarity to the medicine. And then likewise for post macrodose journey as well. So I had this really big experience and it's resonating with me. And maybe microdosing after is a way for continuing the integration. It's
Okay.
it's all, yeah. It's all like
Define microdosing versus macrodosing versus journey, in your opinion.
great question. So in my opinion, a you'll hear the word subperceptual a lot in regard to microdosing. And so it's like if we listen a lot to like Paul Stamets or James Fadiman, they'll typically say like a very, very low subperceptual dose is 0.05 grams of dried mushroom. And also depending on the strain of the mushroom, depending on the potency of the mushroom.
When you say 0.05 grams, you're meaning milligrams, correct?
No, I I I personally prefer grams. So that would be like, I think that's 25 milligrams.
Okay. You're talking about the active alkaloid inside, not the, because a true microdose in my mind is 50 milligrams, right? Of and that's if it's at 1%. Like if the tested fruit body is at 1%. I'm just trying to gain clarity, like 100 milligrams is normally what I utilize.
Mhm.
And then a macro would be a half gram or 500 milligrams.
Yes. Yeah.
Okay.
I'm going to see, I have a really great chart that
Okay, I love charts.
I'm going to try to find. Right, so this is anecdotal. And this is from a talk that was done between James Fadiman and Daniel Schenken of TAM Integration. And I used this chart also in my microdosing talk. And so I personally just stick with using grams, not milligrams. I find it gets a little confusing for me with milligrams, but 0.05 grams, right? And so you said you like 100 milligrams. That
Yeah,
would
so yeah, like 0.05 is 50 milligrams, 0.1 is 100 milligrams. This is 115.15 would be 150 milligrams, and then 0.2, I don't know, I got a little lost on that one.
right. Yeah, exactly.
So
What?
that's 200 milligrams or 250 milligrams.
Yeah.
Yeah, right. Yeah. Yes.
Well,
The answer is yes.
what I'm
Yeah.
hearing from you is that anything over 500 milligrams or a half a gram of dried mushroom, right? And depending on the strain, is a macrodose. And it's
Mhm.
like, if that's what allows you to feel, if that's what you consider a macrodose, like,
Yeah.
yeah, definitely. And like, I would just say that it's like a low dose personally. I think for me, in my opinion, a macro dose is like something that brings me more into like a journey state. So like anything like over a gram.
Okay. Okay. Cool. Yeah, and everybody's different, as we know. Like it doesn't
Yeah.
matter if you're a 250-pound guy or a I'm a 150-pound guy, it's the I have a high tolerance, and that a big person, it doesn't really it's not like I guess as cannabis would be, you know. Yeah,
Yeah,
cool. Thank
totally.
cool. Thank you for the clarity.
Yeah, I appreciate the question. It's a really great question for sure. I'm really glad that you asked it. Anyone else?
If no one else, I have another question. Um, any microdosing programs that you would recommend on the internet, or do you know of anything that where you could recommend? If there's any programs for on out there that you feel confident in or safe?
Like for learning
Or just
about?
yeah, microdosing like protocol, like program to learn about it and kind of go through a type of cohort, like, 1 to 3 months, so it's like a
There is a
accountability kind of a
there is moms on mushrooms. And it's for moms, but guess what? They're making one for fathers. And
that's awesome.
I don't know if you're a father or not, but that's going to be a really, really great cohort. And nothing else is coming to mind at this
Okay,
moment
cool.
specific to microdosing, but let me think about it and get back to you
Sounds
about that.
great. Thank you, Josh.
Yeah, you're welcome. Cool. Well, we're at time. I always like trying to end like on time. If I say if I'm going to end at 2:30, I'm going to try to end at 2:30. So appreciate you all being here. Thank you so much. I invite you to turn off your cameras and like wave goodbye or type in the chat, whatever works for you. But thank you so much for being here. Really appreciate you all. Have a great rest of your day. And I'll be in touch with emailing some more information to you all. Thank you.